So I'm Kierra Pritchard. I use she, her pronouns, and I did my practicum with Fraser Health under the Healthy Schools program. And so today I'm mostly focusing on the development of an evaluation toolkit, but many other things regarding evaluation happen during this practicum placement as well. So they kind of feed into it. Anyways, so firstly, I would like to acknowledge that I am calling in from the traditional, ancestral, and unceded territories of the Coquitlam people, Katzie Nations, and Coast Salish Nations. I would also like to acknowledge that Fraser Health provides care on the territories of the Coast Salish, Inkla, and is home to 6 Métis chartered communities. On top of that, I just wanted to acknowledge everybody who's helped us all through this term. So my supervisors were Carrie McDougall, she's the Healthy Schools Program lead, Sarah Fielden, the evaluation lead, and of course, Dr. Barr and Dr. Fransden for all their support, and of course, my family and friends, and all of you guys as well along the way. So this is just a little overview. So I'm just going to give a little background about the Healthy Schools program, kind of the frameworks it uses, and a little bit of context there. The importance of evaluation for this program, and then the topic of how a toolkit for evaluation came up, data collection and selection methods, as well as an evaluation tool, and then recommendations and implications. So, as I said, I did my practicum with the Fraser Health Healthy Schools program. So the Healthy Schools program really aims to create a healthy and vibrant school environment through collaboration and partnerships with the districts all throughout the Fraser Health region. So they work with all 11 regions, and their primary contacts a lot of the time are superintendents, district principals, vice, like community coordinators at the district level, kind of those types of people a lot. And this program adopts the comprehensive school health approach to really target health well-being within the school environment. So it really tries to bring in this evidence-based framework to guide what we're doing. So this diagram in the middle here, this orange circle in the middle is comprehensive school health. So it is composed of 4 key pillars, being school policies, relationships and environments, teaching and learning, and then community partnerships. So these pillars are largely interrelated, and the needs work synergistically really to make an impact on wellness. So on top of this, there are various key conditions that are required to take a comprehensive school health approach. So there's about 12, but I'll just list a couple just to give you guys an example. So one of the key ones is using students as change agents, really having administrative leadership, having that community buy-in is what really helps something become successful in a school setting. But then also more so on the contextual side, having factors like time, obviously, and capacity, which many people have talked about. But also this idea of schools really being ready and having that readiness and that willingness to go and put time and energy and research and all that stuff into implementing programs. So the second outside ring here around the orange is the wellness areas that the Healthy Schools program focuses on. So the 5 key ones, or the main ones, are active living, healthy eating, healthy sexuality, substance use prevention, and of course, mental wellness. And so this work is done through dedicated Healthy Schools public health nurses. So these nurses work directly alongside districts and identified schools, just a couple if they're very interested. And then they will work with the districts and schools in a number of different ways, depending on the needs and preferences of the schools and districts themselves. So some examples would be a lot of like grant writing right now, organizing different youth summits and events, developing and providing capacity building workshops for both students and teachers or staff in the schools, and then providing professional development opportunities as well. And then we have this outside blue, which is the process that is used by the Healthy Schools program. So they really follow an explore, plan, act, evaluate type process to really get everything going. And then the last outside ring is examples of partners, which was pre-discussed. So this is the framework that was just kind of touched on. So the explore, plan, act, and reflect. So this kind of splits into two main sections. So this is really a mix between the health and education sectors, and it really requires collaborative approaches and collective action to really build these healthy school environments between the two. So on the top, it kind of shows what education partners can do, gather evidence, focus, plan, evaluate, take action, and also involving health partners all throughout these stages and really helping to interpret data, participate in knowledge exchanges, among many other things. So the importance of evaluation for this program. So one portion of my practicum was the development of an evaluation toolkit guide that Healthy Schools public health nurses can use and share with their partners as well. So this project really stemmed from a recommendation of a recent evaluation where partners all throughout the districts described a need for an educational material or some type of toolkit that could really help them see what type of impact or how effective the projects and initiatives they are implementing really are. So the overall importance of this really goes back to supporting the Healthy Schools nurses and their partners, obviously, making sure that the evaluation toolkit is accessible and user-friendly because it is going to be used by like teachers, principals, different sector other than like a health or research base necessarily. To really establish a step-by-step evaluation approach. So nurses in the different districts, because they do so many different things and they have so many different programs and initiatives going on, it's really important to kind of give them a 1, 2, 3, 4, here's what you can do, here's how you can really, produce something valuable for your partners and they can share it. And then also fostering consistency. So my data collection approach was to incorporate an array of different methods and include a variety of different types of resources and documents to ensure a well-informed guide. So I leveraged both gray literature and academic articles to capture a range of perspectives and insights. And then also academic articles as they offer a lot of depth and rigor. And then the gray literature kind of complements this by offering valuable practical insights as well. So secondly, I made sure to include both internal and external documents. So Fraser Health has many evaluation documents, but they're quite long, very jargony and very research-based, but they make great places to start at or to reference back to and kind of adapt and modify to create something that's a little more focused on a school-based setting with children. So lastly, I used multiple databases that were ranging from like Cochrane Library to PubMed for scholarly type articles. Gray literature, I mostly used a lot of government websites and collections, some grassroots organizations, and then different research institutes like the Canadian Institute for Health Research, that type of stuff. And then data selection methods. So the key things I really looked for here were just making sure that it was actually relevant to a school setting and focused on a variety of different diverse factors because Fraser Health is a very diverse region, especially in BC. I believe it is the most diverse region. So it's really important to understand those types of contextual and demographics as well. And then reliability and validity of the data. So ensuring the data is coming and is well informed. And then having a variety of different data to complement each other. So the evaluation toolkit itself came and was sectioned into 3 main things. So the evaluation background, just touching on what is evaluation, why is it important, types of evaluation, and when to evaluate. The second section was the section that nurses and partners really wanted to know the most about. So really this evaluation process, different evaluation lenses. So really taking in a health equity lens, a cultural safety and humility lens, those types of things, as well as evaluation planning. So having like a 6-step planning guide to really give them a good understanding of what they need to do and almost like a checklist to ensure they're not missing any steps. And then the third section was guiding documents and resources. So for any section they want to learn a bit more about or something they're maybe not quite grasping, they can go back to those modules or work through some different documents to really get a better understanding. So those got broken down into, once again, like looking at evaluation lenses, how to develop evaluation questions, lots around program theory and logic models. And this is kind of just the 6-step model here, just so you guys can see. The toolkit's a little bit longer, so I figured I'd just put a little bit in. But yeah, so the 6 steps go over program profile, program theory and the logic model, intended uses and audience, evaluation questions, evaluation design and methodology, and then communication and dissemination aspects. And recommendations for the use of this document is that it is more so an introductory evaluation document. So just to give people a good understanding and a good starting place to run some evaluations and just see how these initiatives and projects are faring out, just so they can informally talk about it or share with other schools. A lot of times schools are interested, especially following COVID, on projects and initiatives in other districts or other schools and how those are faring out. So having an evaluation to say, oh, we saw this happen or we saw this impact, and having a little document is really helpful sometimes. The second recommendation is to ensure that you engage and collaborate with the key partners throughout this development process. So they really do have a lot of good insights that should be accounted for throughout the whole process. And oftentimes the partners, in this case, at least, are very interested in being a large part or conducting the evaluations alongside the nurses. And lastly is, or not lastly, next is focusing on adopting appropriate lenses. So as I said, Fraser Health is an extremely diverse region. It's the most culturally and linguistically diverse region in BC. So it really is important to understand the different nuances and take the appropriate lenses for that. And then lastly, just modify and adapt as needed. So it's not set in stone. Everything can be modified. You can adopt to best practices as they come out, and just keeping that idea of like a feedback loop going. And that should help everybody with implementation. And then lastly is implications. So this really ties back into the idea of evidence-based decision-making, improving program effectiveness, building capacity within the community and the schools themselves to do evaluations in itself, and then engaging the community and providing students with empowerment, adaptation and modification, and then accountability and transferability. So really understanding that students, teachers, principals, district members, everybody really does like to see what's happening, and they like to be involved in the process as well. And so just any questions or comments about that, I'd be happy to talk about.